Hello, my name is Anthony. For my clinical rotation, I went to a skilled nursing facility. So it was both inpatient with assisted living and memory care, as well as outpatient with people coming into the clinic. So the clinic itself was just a really large room at the end of the nursing home. We had two PTAs there. One of them was my CI, one PT who was there just a couple days a week, a speech therapist, and one OT. We didn't really have any special equipment there. We didn't have like a pool or anything. We mainly just used basic things like dumbbells and TheraBands and ankle weights. We did have a stationary bike called a New Step there, but that was about it. Um, I typically saw about 8 to 10 patients a day. It was mainly just, of course, a geriatric population. Most of them had just generalized weakness or Parkinson's, and a few hip replacements here and there. My day to day, it usually started with me getting there about 10 minutes early and looking at the schedule printed out for me that had the list of all the patients I had to see that day and their times, of like how long I have to see them. And then what I would do is I would try and plan out when I would see these patients because some of them would wake up really early for their breakfast and others wouldn't wake up until like noon or maybe even after. So, based on their schedules and what they request, I would try and see them at that time. So, they're like, it benefits both of us to see them when they're at their best and most aware. So, I'd pick four patients to see because I normally saw each patient for about an hour. So, with me getting there around 8 o'clock, I'd see four patients, then it'd be noon. I would have my lunch around then, and during my lunch, I would be normally catching up on notes while I eat. So I'd make sure that I didn't mark down that I was having a long lunch break. I would just like only count the time that you aren't actually working. So just when I'm eating, so it'd normally be about just like 20 minutes, but I'd be actually eating for like 40 to 60 minutes. Um, then after lunch, I would see about four more patients, and then it'd be time for me to leave. Um, as I got better, um, I would take less time on notes because I would know what I want to say as I'm doing it, and I would be able to type better while I'm seeing the patient. Um, so I just had a little bit more time and things seemed to flow better. Um, but it really wasn't too bad. For my first days there, it was really simple, and I just kind of followed the CI. He showed me around, and I got used to the facility and the patients, and just like the schedule of like when they eat breakfast, lunch. Um, I wasn't there for when they're eating dinner, but when they would have like activities and stuff. So the first day wasn't too hard, and I was able to get the hang of it really quickly. Um, I feel like there are a few misconceptions about working there. Um, People will say things like you have to treat like all of the people there like they're children, like you have to dumb things down. And that isn't really necessarily true. That's maybe about like only halfway true because we almost know like a whole nother language of things that we learned. And I don't think it's really fair to say for like we have to dumb things down for them because we have to dumb things down for like pretty much everyone. Um, I feel like a lot of the people that I saw, I feel like most of them were pretty aware. It's just the memory patients that I needed to have a lot more patience with and dumb things down a little bit more like they are children. But that isn't something that you regularly see in the normal patients. Um, I feel like they also, I also hear that people will say, like, you're gonna have a really easy time, or because they're all like gonna be nice old ladies that are gonna be baking you cookies and stuff. But on the flip side, I'd also hear that that's gonna be really hard because they're all really stubborn and set in their ways, and it's like teaching an old dog new tricks. Honestly, I've seen my fair share of both. I've seen people that on my last day I was getting like some cookies and I was getting hugs and thank yous from some of the older people, and um I've also had people that refused to wear a gait belt, and I had to really kind of work with them and like get them to understand this is something I have to do. It's part of what I'm supposed to do, and it's even what the CI wants me to do. And once you start to kind of say like the CI wants it, it's not just like an inexperienced thing. They'll generally work with you then on putting it on. I feel um, some things that are true about it is you'll hear people say you have to take patients who like the bathroom and stuff. And honestly, that is the case. I had to take a few patients to the restroom, and it really wasn't too bad. You just walk them there, and sometimes they'll be able to take care of themselves after that, and sometimes they won't. My CI was with me when I did it, so he did like the hygiene part of like having to wipe them down, so I didn't have to. But just be prepared. That is something you might have to do. Um, some other things is you'll have to talk loudly and you'll have to speak confidently to these patients because sometimes they just don't hear you, and that's just how it is. And you'll be talking to them, your voice will feel rough, and you'll be like, this is harder for some reason. And you'll look in their ear and you'll see they aren't wearing their hearing aids, and you'll solve a mystery right there. Uh, Another one is um, sometimes your patients will just be really upset, really emotional, and really spontaneous. And you're just going to have to really motivate them to get them to work with you. Um, so, just the biggest takeaway is just be polite to them. They're all like people, they're just older, and they just really, most of them just want to get better and go home or be more independent. So just try and be professional and don't be afraid to be these people's friend because they're going to be lonely. They might even show like signs of depression. Just make sure you take care of them and you do your best to respect them.